What are the glomerular diseases? Glomerular diseases, also called glomerulonephritis, refers to a group of diseases that cause inflammation and destruction of the glomeruli, leading to leakage of proteins or red blood cells with urine and causing nephritic or nephrotic syndrome. The clinical picture of glomerulonephritis can be a nephritic or nephrotic syndrome, depending on the main features of each disease. If the patient complains of frothy urine and severe peripheral edema, these are the symptoms of nephrotic syndrome. The most important feature of nephrotic syndrome is massive proteinuria, because it is responsible for all other features of nephrotic syndrome. To be called nephrotic range proteinuria, the amount of protein in the urine must be more than 3.5 grams. This is considered severe proteinuria. The presence of proteins in the blood generates osmotic pressure, which is responsible for keeping fluids inside the blood vessels. For this reason, the loss of proteins in the urine leads to loss of osmotic pressure and thus causes fluid to leak out of the blood vessels and into the cells of the body, causing severe peripheral edema. The loss of proteins in the urine stimulates the liver to produce new amounts of proteins, but the liver begins to synthesize proteins and fats at the same time, trying to compensate for the lack of proteins. This leads to hypercholesterolemia, or high level of cholesterol in the blood. Antithrombin is a type of proteins prevents formation of thrombus and loss of this protein in urine, leading to excessive formation of thrombi or hypercoagulable state. Last one, the presence of immunoglobulins in the blood helps the immune system to attack and eliminate the microorganisms like bacteria. As you know, the immunoglobulins are a type of proteins and loss of these proteins in the urine, making the body more prone to infections. Now let's talk about nephritic syndrome, an inflammation of the glomerulus that leads to the breakdown of the basement membrane and the loss of red blood cells with the urine, which are dysmorphic in shape because they pass through narrow openings and cause hematuria. Hematuria in nephritic syndrome means the presence of red blood cells in the urine. The patient often describes it as dark-colored, tea-colored, or cola-colored urine. The presence of red blood cells in the tubules causes the red blood cells to take on the shape of the tubule, which is called RBC casts. In nephritic syndrome, we can also see proteinuria, but here it is mild proteinuria, or subnephrotic range proteinuria, which means less than 3.5 grams per day, which causes mild edema, often periorbital edema, and rarely generalized edema. The presence of red blood cells in the tubules leads to their blockage, and this blockage causes oliguria, which is a decrease in urine production, as well as azotemia, which is a high level of waste products such as creatinine and BUN in the blood. Also, there is hypertension due to the high release of renin from the inflamed kidney, which activates the RAS system, which leads to water and salt retention in the body, which in turn leads to hypertension. Which diseases cause nephritic syndrome and which diseases cause nephrotic syndrome? Diseases that cause nephritic syndrome are infection-associated glomerulonephritis or post-streptococcal glomerulonephritis, Goodpasture syndrome, IgA nephropathy, also called Berger disease, Alport syndrome, and membranoproliferative glomerulonephritis, while the diseases that cause nephrotic syndrome are focal segmental glomerulosclerosis, minimal change disease, membranous nephropathy, amyloidosis, and diabetic nephropathy. What is nephritic nephrotic syndrome? Nephritic nephrotic syndrome is a condition where there is severe and significant damage to the glomerular basement membrane, leading to loss of red blood cells in the urine, causing hematuria and nephritic features. At the same time, the impairment of the charge barrier causes proteinuria or loss of proteins in the urine in a nephrotic range which is more than 3.5 grams per day and forming features of nephrotic syndrome. It can occur with any form of nephritic syndrome, but is most common with diffuse proliferative glomerulonephritis and membranoproliferative glomerulonephritis. Finally, what are your opinions about this video? We are waiting for your comments and opinions about the video.